Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Social Communication Questionnaire assesses communication skills and social functioning in individuals. It primarily screens for autism spectrum disorder by evaluating behaviors related to social interaction, communication, and restricted or repetitive patterns. The tool focuses on identifying symptoms consistent with pervasive developmental disorders. It is used to support clinical decision-making and early identification of autism spectrum disorder in children and adolescents. The questionnaire relies on caregiver report and provides standardized information to guide further diagnostic assessment. The Social Communication Questionnaire is indicated for use in children aged 4 years and older who are suspected of having autism spectrum disorder. It is particularly useful in populations exhibiting developmental concerns related to social interaction and communication. The questionnaire serves best as a screening tool in clinical settings to identify individuals requiring comprehensive diagnostic evaluation for autism spectrum disorder. Evidence demonstrates that it effectively distinguishes between children with and without autism spectrum disorder in both community and clinical samples, with sensitivity values ranging from 0.75 to 0.95 and specificity values from 0.70 to 0.85. It is most useful in outpatient clinics, developmental pediatric practices, and educational assessments where early identification facilitates timely intervention. The Social Communication Questionnaire consists of 40 items designed to assess communication skills and social functioning. Each item is structured as a yes or no question, focusing on behaviors exhibited over the individual's lifetime or the most recent 3 months, depending on the form used. The administrator should read each question aloud or provide it in written format for self-completion, ensuring that the respondent understands the questions clearly. Responses are scored by assigning 1 point for each answer that indicates a presence of atypical behavior consistent with autism spectrum conditions. The total score ranges from 0 to 40. A cutoff score of 15 or higher suggests the need for a comprehensive diagnostic evaluation for autism spectrum disorder. Scores below 15 indicate a lower likelihood but do not rule out developmental concerns. It is essential to interpret results alongside clinical judgment and additional assessments, as the questionnaire serves as a screening tool rather than a diagnostic instrument. The Social Communication Questionnaire demonstrates variable sensitivity and specificity depending on the population and cutoff score used. Sensitivity refers to the tool's ability to correctly identify individuals who have the condition, in this case, autism spectrum disorder. Specificity indicates the ability to correctly exclude individuals who do not have the condition. Studies have reported sensitivity values ranging from 0.75 to 0.90. reflecting that the SCQ correctly identifies 75 to 90% of true positive cases. Specificity values generally range from 0.70 to 0.85, indicating that 70 to 85% of individuals without autism are accurately classified as negative. For example, a sensitivity of 0.80 means that out of 100 individuals with autism, 80 will be detected by the SCQ, while a specificity of 0.75 means that out of 100 individuals without autism, 75 will be correctly identified as not having the disorder. These measures are critical in clinical settings to balance the risk of missed diagnoses against false positives when using the SCQ for screening purposes. The Social Communication Questionnaire was developed in the late 1990s by Michael Rudder and colleagues as a brief screening tool for autism spectrum disorders based on the Autism Diagnostic Interview Revised. Initial validation studies demonstrated a sensitivity of approximately 0.85 and a specificity near 0.75 when using a cutoff score of 15. Indicating strong discriminative ability in distinguishing affected individuals from typically developing controls. Subsequent research across diverse populations has corroborated these findings, with multiple investigations reporting sensitivity values ranging from 0.8 to 0.95, and specificity values from 0.7 to 0.9, supporting the instrument's reliability and validity. Factor analyses have further confirmed the SCQ's structure aligning with core autism symptom domains, while test-retest reliability studies indicate consistent scoring over time. Additionally, convergent validity has been established through significant correlations with other well-validated measures of social communication and autism symptomatology, reinforcing the SCQ's utility as a valid screening measure in both clinical and research settings.
Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.